the solutions to your pain. If you've been suffering backaches, neck aches, headaches, you know how debilitating it can be. Steven Shoshani is a top chiropractor in New York City. He's been treating patients for over 16 years.
Think all I do is adjustments all day? Think again. I have the newest and most effective treatment to zap away your pain.
No Pill Pain Busters. It's one of the most common and debilitating pains. 70% of you will experience it in your lifetime. I'm talking about neck pain. And it comes from many reasons. I built this high-tech model to bring this to life. But sometimes you sleep wrong. A little odd position. You might not even notice it. It'll start to weigh you down. Or you're working at your computer. When you stare at it for long periods of time, you forget what you're doing to your muscles, and it begins to weigh you down even more. And then, of course, there's texting and all the other fun things we do on our smartphones, and that will weigh you down a little bit more. And the coup de grace, the biggest culprit of all, the one that really causes the biggest issues for us, is stress. And when you add stress to the equation, you literally break it off. You feel like you've been hit by a ton of bricks, and that pain is not easy to get rid of. But that, my friends, ends today. Steven Shoshani is joining us. He's a chiropractor, and he has the no-pill pain buster for your neck. It's a very cool procedure. It's called cold therapy. He's here with his patient, Kelly. Welcome to the show, Kelly. Steven, how are you? So I'd love to learn more about this cold therapy. This is something that I had not heard of before the show. So what is it exactly?
Cold laser therapy is a low-level laser therapy that reduces pain and inflammation and decreases the need to take pain medication. The laser, we shine on an injured area, and what it does, it improves blood flow to the area, decreases the pain, inflammation, increases the muscle elasticity, and improves the overall pain response.
Now, you're a chiropractor. Most of the time, I think of chiropractors as doing manipulations. Why would you use a laser in your practice?
We still adjust and treat our patients, but I'm always looking for new and innovative ways to have patients avoid taking pain medication. So tools like this help me get my patients better faster.
Would you mind positioning this?
Absolutely.
And Kelly, while he's doing that, describe your condition a little bit. Again, we almost all have it. So what brings on your back pain?
Just bad sleeping, bad daily practice posture, working physically too hard.
Let me turn you this way a little bit just to get a better shot for everybody there. Okay. So classic reasons for the pain. And Steve, you're just putting these lights at a few inches distance from Kelly's neck.
Yeah, the light is going to penetrate through the skin. It's going to get absorbed by the areas that need the laser light. And the laser light's going to help, again, like I said, promote tissue healing, improving the blood flow to the area.
Do you feel this at all?
Nothing.
And what kinds of neck pain does it work for best?
All neck pains, Dr. Oz. People that have arthritic neck pain, people that have disc herniations, radiating pain, like carpal tunnel syndrome, stiff necks, like when you wake up in the morning and you can't turn your neck torticollis. It works great on most all neck cases. And
let me be quiet, just show you. I mean, if Kelly was in your office right now, what exactly would you do?
Well, what she'd be doing is first I'd leave it on, and then I'd have her go through some ranges of motion really slow. So turn your head slowly to the right. We're doing this to increase surface area, so we're affecting the traps, the scalenes, all the different muscle groups in and around. So she'd be here for about 5 to 10 minutes going through this range of motion after we did our treatment.
Any side effects related to it?
No side effects.
Should have asked that earlier, I guess, before you had this done.
No side effects, super safe.
And you said only 5 to 10 minutes?
5 to 10 minutes.
And how often do you have to have it done?
3 to 5 times you should definitely see some results. Some patients see results within the first treatment.
Well, you sit there and relax. I'm going to show you what I think is going on with the cold laser therapy. So I built you a model of what your neck, or frankly any part of your spine might look like. And neck problems typically happen not because you've got issues with the discs in here. These are the bones again. These discs are often pretty solid, but you'll get inflammation represented by these little green balloons. And they can happen again because you slept wrong, because you're in weird positions. Surgeons get this because we're over your bodies like this all day long, with the arms hunched up under a lot of tension, trying to make sure we don't do anything wrong. And that causes irritation of these joints. So once it's happened, this inflammation starts to fill in the spaces, and we can't move anymore. Our whole neck becomes rigid. You've all lived through this in your own lives. For whatever reasons, you've brought this upon yourselves. So what this therapy does, you think of most lasers as zapping things, but this doesn't do that. This actually, in a very gentle way, changes the inflammation. You're always going to have a little bit of this going on, but it's those big, massive boluses of inflammation caused by some weird thing you did that mess you up. And when we aim this and change it over 5 minutes, as Dr. Shoshani said, you'll be able to dramatically affect the amount of inflammation. And as that inflammation goes down and shrinks and shrivels something much less of a problem for you, guess what? You begin to start to be able to bend again. Now your neck will turn. And now that your neck turns, you'll be able to, once that discomfort's gone, stay limber and stay loose. So this is the whole purpose of cold therapy. So Dr. Shoshana, what is the classic kind of results you might anticipate? So Kelly's had this neck pain. I'll just speak for you. Let's say you've had it for a week or two, and it's been an irritant. You've been taking over-the-counter pills, which is part of the reason we're doing the show today, is not to have people reach for a pill reflexively, because you don't have to do that. How impactful can this be?
Well, definitely a better range of motion, decreased dependency on pain medication, and it actually improves the tissue quality. So the range of motion can improve, and also the radiating pain that patients may experience goes away. So range of motion improvement and overall cell repair. So tissue gets better. There's a better quality to the tissue.
How's your neck feeling now, Kelly?
There's not an immediate change. It usually happens within a couple hours. In the next day, in the morning, I'll feel a tremendous difference, a lot more mobility. This is actually my 4th time.
Oh,
so
good.
I don't wake up with the pain, which is really nice.